Let's go. If you struggle to understand pharmacology, then this channel is for you. As a nursing school survivor, I know just how hard pharmacology can be. Hey there, Dan with Nurse Blueprint, and I help students get better grades in less time. My goal is to get you more comfortable with commonly tested drugs and how to use them in real emergencies. And that's not all. Subscribers to Nurse Blueprint will learn meds. I make complex concepts more understandable. You're going to save time because my clips are short, so you learn quickly and without fluff. You're going to get better grades because I'll give you methods to ace your pharmacology exams that actually work. There's no need to struggle with pharmacology any longer. If you want better grades in less time, palpate that subscribe button. It's time to do drugs with Nurse Dan. Are you struggling with pharmacology? To understand heart attack drugs and what's on the test, this blueprint is for you. Let's go. The Nurse Blueprint app delivers pharmacology without the fluff. To get better grades in less time, it's time to do drugs with Nurse Dan. Hey there, it's Dan, and as a nursing school survivor, I know just how hard pharmacology can be. So I created an app to get you better grades in less time. Now, palpate that subscribe button because today's blueprint is heart attack drugs, and it starts now. Heart attacks are one of the more common emergencies that you're going to encounter as a nurse. They can happen to anyone and at any time. So investing the time to learn heart attack meds can and will save lives. Also, how awesome is it that you are going to save a life? But first, we have to know ways to recognize a heart attack, a myocardial infarction, which meds can be used to help, and finally, what's on the test. But first, let me tell you about a rapid response because it's one that really stuck with me. It's the last patient that I coded in the ICU. I remember there was a married couple, probably in their 70s, and they were at home, and the wife started feeling chest pain and collapsed. The husband called EMS and started compressions, and she found her way into the ICU where I was working. She was still on life support the following day when I met her, and I'm getting a report from the night shift nurse. She's telling me that the ambulance showed up and they got a pulse back after 8 minutes of CPR. They diagnosed her with a heart attack. They took her to the cath lab and she didn't need a stent. In fact, blood pressure was great all night. The only real change was the rhythm change. She had been in sinus and now she was in AFib. Other than that, she was sedated and she was on the ventilator, but the doctor wanted to see if she could wake up and maybe extubate. So later in the shift, sometime around lunch, I'm in the lounge and I hear this yelling. It's a nurse yelling to, "Can somebody give me some help in here?" So I throw the door open from the break room and I see the nurse and she's with the patient. She's with my patient. So I'm sprinting from the break room and I look up at the monitor. Blood pressure, it's 60 over 30. Heart rate, it's 50, 40, 20. The rhythm is a total mess, and then suddenly, boom, cardiac arrest. So I stomped the CPR pedal on the hospital bed, and the head of the bed crashed down flat. And I was the first one to do compressions, and one of the techs rotated in. By around the third round of compressions, I'm standing at the foot of the hospital bed. I'm just watching the patient, and 5 family members are watching in from outside the door, just dressed up, looking great because it was a Sunday and they just left church to come visit her when all this went down. I whispered to the nurse beside me, "She cannot die." All of this studying that you do, it's not just a test and it's not just a grade. Everyone thinks that they're going to rise to the occasion under pressure. What typically happens is you sink to the level of preparation. Getting familiar with crashes like these is part of being a nurse. Let me give you a blueprint to get you familiar with heart attack drugs. Remember this, M-O-N-A. In MONA, the M is for morphine. When heart damage occurs, pain and panic only make things worse. So when it comes to heart attacks, morphine does it all. chest pain, anxiety, rapid breathing, overworked heart, morphine helps them all. O is for oxygen. If blood flow gets interrupted by a narrow vessel, so does oxygen supply. And oxygen deprivation will damage the heart muscle tissues even worse, so support the heart by preventing desaturation. N is for nitro. If a blood vessel is narrow, oxygen supply gets impaired. Nitro allows more oxygen to reach the heart. It expands the blood vessels and opens the faucet, so to speak, and increases blood supply to the heart. A is for aspirin, which makes the body less prone to making clots, so if the root of the problem is clotting, aspirin can help. So what have we learned so far? Chest pain leads to things like anxiety and rapid breathing, so we give morphine to fix all three. Oxygen desaturation makes a damaged heart even worse, so give O2. Remember, if saturation gets low, give them some O's. Narrowed blood vessels can slow blood supply to the heart, so we use nitro to dilate the coronary arteries. Remember, if the heart needs suffice flow, give nitro. Finally, clots can interrupt blood flow, so we make the platelets less clumpy by using aspirin. Remember, if clots happen, chew an aspirin. Are you prepared to give heart attack drugs? Take the post-conference quiz below and find out. And in part 2, I'll answer those quiz questions and teach you a method that has helped lots of students pass pharmacology. So if you have a pharmacology exam or PharmHESI coming up, you don't want to miss this next segment. And remember, if someone tells you to look it up, tell them, I'd rather do drugs with Nurse Dan. Oh, and if you're curious about the ending of the story, after about 4 rounds of compressions, we got her back. There was a pulse, and they actually took her off the ventilator a couple days later. I just remember after getting the pulse back, everyone dispersed. Her sister was still standing there and just had this peaceful looking expression. When I walked up to her, she just looked at me and said thank you and gave me a hug. That was the last patient of my own that I ever coded as a bedside nurse, and I can't think of a better send-off.